Hi, my name is Maxie Friemel, Senior Director of Pharmacy Revenue Cycle Services at Visante.
And I'm Joe Cesarz, Vice President at Visante.
In the pharmacy revenue cycle, we focus on 7 major areas. The first one is our charge capture, where we do a comprehensive analysis of the charge capture from the medications that are purchased to bill. We want to ensure that everything's being billed appropriately. We also do a deep dive into the CDM, or the charge master, to see if there's any room for improvement. The second major areas are cost avoidance. There are many times when it may be advantageous for us to really evaluate medications where we can avoid the cost, especially for those patients that are or underinsured. We can leverage manufacturer-sponsored programs and help avoid a patient from not being able to pay or an unavoidable write-off. The third major element is our payer contracts. We take the top payer contracts and really evaluate them for specific language surrounding medications. We align our reimbursement with the payer contracts to ensure our billing practices are in place. The fourth major element is the inpatient claims processing, where we evaluate inpatient claims for specific codings for select medications that can enhance revenue on top of the DRG. For the outpatient claims processing, which is the fifth element, we evaluate all the procedure codes in addition to the billing and coding of those medications on an outpatient claim to ensure everything is not only gaining the revenue, but also compliant. The sixth element is our denials and write-offs. Denials is an ever-growing problem for health systems, especially in terms of medications. We evaluate medical necessity, prior authorization, frequency limits, and those ever-growing, pesky, invalid NDC denials. We work with organizations to help develop strategies to reduce these denials. And the last section is our appeals. We work directly with organizations to help appeal outstanding denials, especially if they were billed appropriately and have clinical support or justification to have billed that medication. We can help write clinically sound appeals and help reduce that time to redetermination for those organizations.
Visante takes a standard comprehensive approach to evaluating pharmacy revenue cycle services. We start with a project planning phase, which is really to orient the client and all key stakeholders to what lies ahead within the project. Next, we move into a 3-month assessment period, and this involves 2 things. One is a data assessment and analytics, and one is around interviews of staff members, understanding processes and systems that are in place around the pharmacy revenue cycle. Next, we move into a recommendations and validation phase with the client. This includes us sharing our findings, what we found during the assessment, and working with the client to validate those findings and make sure that they agree with the financial opportunities that we're presenting. Lastly, we move into an implementation phase where we work with the client to move our recommendations into reality within their practice.
Each health system brings about new challenges and unique insights that we can use to put together best practices for organizations. Pharmacy revenue cycle is not a term that you've actually heard many times before. So we really are educating both the pharmacy as well as the revenue cycle teams throughout this process.
Our goal is to help our clients achieve high-performing, sustainable pharmacy revenue cycle services.
For more information, visit visanteinc.com.